problems due to diabetes and their prevention. Diabetes can cause many types of foot problems. These problems often occur because diabetes reduces blood flow to the feet and also weakens the veins. Common foot problems. Wounds. Even small wounds take a long time to heal and sometimes get infected. Swelling. Swelling in the feet. Pain. Pain in the feet, especially while walking. Infection. Wounds get infected by bacteria or fungus. How to prevent? Check feet daily. Check the feet carefully every day to see if there are any cuts, blisters, or swelling. Keep feet clean. Wash feet with lukewarm water daily and wipe them with a clean cotton cloth. Cut nails. Cut toenails regularly, but do not cut them too short. Change socks. Wear clean socks daily. Wear loose shoes. Wear shoes that do not rub the feet. See a doctor regularly. See a doctor regularly so they can check your feet. Keep blood sugar levels under control. Keeping blood sugar levels under control reduces the risk of foot problems. How to take care? Take care of wounds. If there is a wound on the foot, keep it clean and show it to the doctor. Keep feet warm. Keep feet warm in winter, but do not put feet in hot water. Do not walk barefoot. Do not walk barefoot. Always wear shoes. Keep weight under control. If you are overweight, try to reduce it. Remember, diabetic patients should take very good care of their feet. If you notice any problem, see a doctor immediately. Contact your doctor for more information. Disclaimer: this information is for general information only and is not medical advice in any way. Always consult a doctor for any disease.